Welcome to Wick-Splaining. My name is Chuck Wick, and with me I have my brother Paul Wick and our producer Caleb. We are going to be discussing political issues on the local, state, federal levels.
Can I talk?
I'm the host, so I'll do as much talking as I want.
I'm not sure I enjoy that.
Well,
you can argue about who's going to do more talking later. We have a show to do.
We're brothers. We're going to argue.
That's fine, but the people on the other end don't want to hear you guys arguing right now. They'd rather hear about a good conversation that you guys have planned for them.
All right.
You're right, Caleb. All right, Chuck. Well, let's get to the topics.
Okay, we have a great show planned for everybody today. Welcome to Wick-Splaining, where we drink and we know things. Today we're enjoying Four Roses Small Batch. This is a Kentucky straight bourbon crafted from 4 select bourbons distilled and aged in Lawrenceburg, Kentucky. What do you think of it, Paul?
It's pretty good. It's not too harsh or anything. It's got a good taste to it. Mm-hmm. It's a nice whiskey. It really is.
I like it too. What do you think, Caleb?
Well, I mixed mine with some Pepsi because I don't drink whiskey straight up anymore, and it's not bad. It works really well.
It's good blend.
Yeah, he's got Pepsi Cherry over there for anybody.
We apologize. Caleb has issues with that.
The only whiskey I can drink straight up is Crown. I don't know why, but it is. So, I'm white trash.
I was gonna say you don't like the good whiskey, I guess. But anyway, the music from our intro and outro are hit songs by Desolate, a Dayton, Ohio area band. If you like that, then check them out. They have videos and things on YouTube, and they have a Facebook page, so you can find their music on there. Our topic today is COVID-19. We will cover the timelines of events, the response in Ohio, our local area, and our personal opinions surrounding all the events. All of my research information came from the CDC's own website, www.cdc.gov. The CDC defines COVID-19 as a respiratory disease caused by the SARS-CoV-2, a new coronavirus discovered in 2019. The virus is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. All right. Well, let's open up the discussion on that. What does anybody think about that?
It's a little crazy. I mean, it depends on who you talk to, on how it's transmitted, what the small droplets, big droplets. Mm-hmm. It gets a little crazy into that. I've heard from local doctors. The masks that everybody's wearing, the cloth mask, is not stopping the small droplets that is this Delta variant. Mm-hmm. And so the mask really isn't helping at all.
Right.
In that fact,
right.
And then the CDC says, well, I'm sorry, maybe not CDC. I didn't actually look at the CDC website on this specifically, but our local Board of Health, County Board of Health says that if you're within 6 feet, then you need the mask on. Within 3 feet, the mask doesn't even protect you. You're going to get it. You're in too close proximity. Outside of 6 feet, you don't even need a mask.
Right. And to specify on that, what they mean is that if you're within 3 feet of someone who is infected, if you're obviously 2 or 3 people that are not infected with COVID, you're not going to get COVID, no matter whether you're wearing a mask or not.
Right.
So. The CDC also states that some people who are infected may not have symptoms. For people who have symptoms, illness can range from mild to severe. Adults 65 years and older and the people of any age with underlying medical conditions are at higher risk for severe illness. People 12 years and older should get COVID-19 vaccines to prevent getting and spreading the illness. Now, again, this is straight from the CDC website. I just read it word for word from what they say. Now, you may have your own opinions on, the vaccine and everything, but we'll get into that a little bit later in the discussion.
12 years and older has also obviously changed. Now we have the 5 to 12.
Yes.
vaccine,
Right.
so.
I mean, and there are developments
It's
that are
always
coming
changing.
along because vaccines are changing. The companies that are making these vaccines are making them available to everyone. Available to anyone that has any underlying conditions as well. So it's just any other comments on that?
I mean,
Well,
it's one of those, it's one of those weird things where I never thought I'd live to see a virus that was man-made spread as fast as it did and through the wild. You see those movies like Planet of the Apes and stuff, and you see the movies like Outbreak, and you're like, oh, that'll never happen, and then all of a sudden, boom, it's reality, and you're just like,
Right.
what the hell happened?
Yeah.
And then, you just got the...
Definitely a surprise.
Yeah, it was the shock and surprise, and then it's just the whole, obviously every day there's new stuff that's changing and new guidance and everything. It's hard to keep up with everything. So.
Right. Paul?
I'd like to read a little bit from our local newspaper here about the COVID-19 posing to health issues to kids. So it says, specifically, while COVID-19 poses less of a threat to children than to adults, experts say it is more worthwhile to compare the risk it poses to children with other risks children face. Now, it goes into a little more in-depth information here, but it's just saying that, there's been a huge uptick in the number of cases that we see in children, but it's also, because of the Delta variant being the it's less lethal, but more spreadable.
More contagious.
That's not. I don't think that's a word. More contagious, I think, is probably much better. Thank you, Chuck.
Yeah.
It's yes, because kids are all in everybody's faces anyhow. Nobody cares when a kid gets in
Right.
your face. Everybody gets in a kid's face. I mean, when you
Especially
have
if you're a parent and that your kids you're talking to.
you
or
take a
whatever,
kid.
yeah.
It happens all the time.
Right,
You take a kid
right.
out into a park, and what does everybody do? They run around. Oh, let's see the little baby. All the way up to maybe a couple years old. Oh, look at that little kid.
Well, it's like your kids. They run up to me, Uncle Chuck.
Oh,
They're
yeah.
running
Oh,
up to
yeah.
me and getting up in my face,
Yeah.
giving me a hug and all
Oh,
that
yeah.
kind of stuff. So, it's just you're always going to have that contact, and so it's difficult to know where your exposure is coming from. So you have to take the precautions that you feel are necessary for yourself. So let's move into a little bit of the timeline that we talked about earlier. From the CDC timeline of events, the origin of the virus and the first reported cases are in December of 2019, a cluster of patients in Wuhan, China, began to experience shortness of breath and fever. In December 31st of 2019, the WHO China office was informed a number of cases of pneumonia of unknown etiology, which means unknown cause, detected in Wuhan province. All cases connected to the Huanan seafood wholesale market in Wuhan.
Easy for you to say.
Yeah, I probably butchered that, but I'm not sure.
Have fun with that one.
January 7th of 2020, Chinese authorities identify and isolate a novel coronavirus as the causative agent of the outbreak. And January 13th, 2020, the Thailand Ministry of Public Health confirms the first imported case of lab-confirmed novel coronavirus from China. So this is kind of the beginning of the virus starting in China, moving out of China into Thailand. The China office of the WHO is reporting to the rest of the world that they have this virus now that's being tracked by them, and that there's an outbreak possible at this point. So they're trying to inform the world so that everybody can start getting prepared for it. Do you have any ideas or thoughts on this, guys?
I mean, it's nice when other countries share medical, anything medically. I mean, it's just, something happening in your country, it's going to spread. We are a world closer together than we've ever been before.
Yeah, population is really huge too now. It's the largest it's ever been in history of mankind.
Right, and we travel. I mean, today, I can almost guarantee, and I have no stats on this, but you
Right.
can almost guarantee that someone in the United States has either flown to or came from China.
Right.
You know, and somebody in China has come from the United States today.
Well, people
it's
go
just-
back and forth to China all the time
All
for
the
business,
time.
for teaching. I know I
Yes.
actually even looked into teaching English to children in China job at one point. So I know that there are teachers that are over there doing that job right now that are in contact with those people in China.
There's missionaries coming from churches going across the, either Ukraine, South America.
Right.
I mean, people travel this world constantly. There is not, there's no, well, it's over there.
Right.
That just is not a thing anymore.
Right. And to prove that fact, on January 17th of 2020, the CDC deployed a team to the Washington state to assist with contact tracing efforts in response to the first reported case of COVID-19 in the U.S. So that was only in January 17th of 2020. So we're not very far from when China started reporting this as something,
Right.
As a thing of interest, basically, to the rest of the world.
Yeah.
We're only about 3 weeks out from there, where we now have our first case in the U.S. So that obviously proves that there's a lot of travel from the U.S. to China, or at least that area.
Right. And proven case, too.
Yeah.
I mean, there is speculation in the medical community that the COVID virus was over here in 2019 as early as September in some estimates.
Okay.
And it's an estimate. It's not. There's
Right,
nothing
right.
proven. That's why the CDC doesn't have it on their website like that.
Right,
But
right.
there are medical experts out there that has said that estimately, because they don't have exact proof, that we believe it's been here since around September, October of 2019
Okay. I mean, and that's a possibility, but
we-
like I
we
said,
always
there's
think
no
the,
testing or anything that was done at that time.
the Socialist Republic, the Communism Republic, the Chinese great government that they are, that they're going to actually tell people the truth. They do a great job of, doing whatever they want.
Yeah.
So
So we'll move on to the next, unless Caleb, you have anything to say?
I mean, it's one of those things where, being a Republican, we had the cases come to Washington.
Mm-hmm.
We should have shut down our border right then and there. We basically should have isolated ourselves, keep people out. And when we tried to do that, we were, our president, who was looking out for the best interest of all of Americans, was called a bigoted and a racist because he was trying to keep Chinese and Europeans and all that people out of the country. It's like, hey,
Latin Americans too.
Latin
He was trying to
Americans.
shut down the borders all around.
yeah.
So-
And basically, he was fought back on it because they didn't care. They were just looking at, well, you're keeping people out. How un-American are you? Where it's like other countries at this time were already isolated. Like Italy, nothing. You couldn't. Italy was a freaking Ziploc bag.
Yeah, and that actually goes right into my next topic here. As the timeline progresses, world governments are reacting and trials for vaccines are beginning. The CDC starts to announce the recommendations for safety. In February 23rd of 2020, Italy becomes a global hotspot. The Italian government issues decrees to basically shut down the country because their outbreak in that country was out of control at that point. March 11th of 2020, the WHO declares COVID-19 a pandemic. March 17th of 2020, the first human trial of a vaccine to protect against the pandemic COVID-19 begins in the U.S. Actually, I was not aware until I started doing this research that the vaccine was already in progress and hitting its first human trials that early on.
Wow.
I figured it was a lot later in the process because it actually took them until, as we get further down the timeline here, you'll see, but it took them until December to actually get the vaccine out to the public and get it to the point where it was feasible to use. But the first human trials were done in March, which was actually very surprising to me. And then April 3rd of 2020 is when the White House, the CDC came through the White House press briefing and issued the new mask wearing guidelines and recommended that all people wear a mask when outside of the home. Now, I know this is where we step into a lot more of the controversial part of it, because a lot of people are either pro-mask or against the mask, and that is your own personal preference. I'm just giving the timeline basically from the CDC. So I'm going to hand it over to Paul and see what he has to say.
So, I mean, I'm not as shocked that the first human trials were so early on and it was created. I mean, if you create something, you know exactly what's in it. You created it. If I bake a cake, I know what I put in the damn thing. So, I know.
Yeah, but I believe with any medication, there's usually some type of trial on some type of an animal or something like that before it moves into human trials.
There should have been,
and I don't believe
there
was nothing as far as I could tell in this timeline from the CDC that states that was done.
Yes, that was my first point about how since China with American money created this thing, we know what was in it. Therefore, but going on top of the other war, where Italy was the first one, maybe one of the first one, maybe not first one, but maybe at least one of the first ones to shut down completely. They were giving President Trump, so much grief about this, but our governors in the states, they limited travel to other states.
Right.
I mean, it wasn't even international.
Nope.
I mean, it was literally like, Governor DeWine would say this month, if people from Florida can't come here, or if you do, you have to quarantine for 2 weeks before you can go out into public.
Yeah.
These things, in the United States of America, we have, separation of powers, and that's a great thing. But I feel like it was a little overstepped on this, but that's a whole nother discussion. But yes, the shutting down the borders, that was, very good for everyone involved, I think, because when you want to, if you have a true health crisis, then you have to limit what is brought in and out. It's like when you go to the hospital.
It's very important.
When you go to the hospital on a normal day, 3 years ago, you went to the hospital to have some kind of a surgery or some kind of an illness you've had or something. What's the first thing they want you to not do? Not take anything outside of what they tell you to take.
Right. So they know what is in your body when they go into surgery.
Exactly. Yep. Not even a surgery. They know what's in your body. If you have a reaction,
right,
they know that, I gave them this,
drug
this,
interactions are a problem too.
Yes.
I mean, if you take something that they don't know about and then they give you something during surgery because it's necessary, then you could have an interaction there. The same thing comes into play when I believe in any kind of medication. As we get further down here, we'll see where there is some medications that were attempted basically throughout this pandemic to see what would happen as far as being able to slow down the progress of it, possibly bring people that were sick out of that sickness. So we can move on to the next topic here. I'm sorry, go ahead.
We had a family friend that was that had COVID, went to the hospital, and she kept putting Vaseline on her nose. Well, the nurses didn't know she was doing that because the nurse was out of the room when she did it. Nurses can't be in your room 24/7; it's impossible.
Right.
But she thought because, growing up, that's what we did. Put Vaseline on her feet. Put Vaseline.
Not Vaseline. Vicks.
Yes. No. Or I'm sorry, Vicks.
Vicks. Yes.
Why
the
would you put
vapor
Vaseline
rub
on your
Sorry.
feet?
All right.
Right.
Hey. All right.
Slide across the floor.
Maybe.
So
she's out there ice skating with Vaseline.
Jeez, I had the wrong V word. All right. Vicks.
I mean, there's Vaseline.
Yes. There's Vaseline and Vicks. Yes. Thank you. You saved me a little bit. Should I redo that?
No, keep going. It's fun. It's funny. I like
All right.
Good
well, if you've ever had I'm assuming she was putting this on when she had her nasal cannula for the oxygen. So if you've ever had a nasal cannula on you, you'll know that it dries out your nose, it dries out your upper lip. It does a lot to cause a lot of problems for you. I know it's necessary because you need the oxygen, but I understand why you would want to put something on there to try to open up that area for you so you can breathe
Correct.
better, and also so that you're not getting all of this dry skin
Right.
and everything in that area as well.
But our brother-in-law, Jay, is a respiratory therapist. And he said that if you put that on your nose like that, it can clog up the nasal
Cannula.
Thank you.
Yeah, the nasal cannula.
I never going to say that word. So that's what was happening to our friend. That's why we had to. We asked our brother-in-law Jay because he's the he has the medical experts, and it clogged that up. Therefore, that they thought the nurses were thinking that she needed more oxygen because she wasn't getting it. Well, it was the Vicks actually clogging up the nasal cannula.
Cannula, yeah.
That's why she had to have it turned up so much.
Right.
They almost had to put a mask on her because they thought.
Yeah, because her O2 saturation wasn't at the level it needed to
Right.
be at,
Yep.
due to the fact that the Vicks was actually clogging up the nasal cannula,
Yes.
causing the oxygen to not be able to leave the device and then also be inhaled into her body.
And then you also had the issue where Vicks has those fumes that
Right.
are meant to,
Clear out your
clear
sinuses.
out your sinuses, and you're basically forcing that down your freaking nose and your lungs
Right.
faster than you're supposed to.
Yep.
Because
Right.
obviously the
Because you're breathing it in at a higher volume.
pace, yeah. And it's
Yeah.
just that was like all bad signs were pointing to that. It's like,
Right.
why? Why would you do that?
Well,
The doctors are there to tell you what you should and should not do.
I understand,
And-
but
and that
she was
bringing
just
it-
trying to help herself.
Right.
I understand
Oh,
why
yeah,
she
yeah.
was doing
And
it.
bringing it back to the point where you have to shut it down. When something gets to a certain point, you want to shut things down to limit what you don't know.
Right.
Right. Okay.
And that's when basically we should have been listening to experts and not. And by experts, I mean local experts, not television
Right.
experts.
The
or
doctor
poli-
who's
or-
actually handling the case at this
Yeah.
time.
Like we mentioned, the brother-in-law, he's a respiratory therapist. He was on the front lines. He saw it firsthand. I mean,
Yeah.
our local hospital in this area had, the nursing home that had a severe case of it. And he was in the thick of it for the longest time. And
Right.
And it's
Right.
all of our hospitals just got inundated. And it's like, I would trust those people ahead of someone I don't even know
Oh yeah.
about anything.
Yeah.
Right. Right. Well, the next topic we'll move to is the U.S. starts to see an increase in the number of cases and deaths. The president enacts initiative to speed up vaccine progress.
Warp speed.
So, April 10th of 2020, the U.S. surpasses Italy as a global leader for reported deaths due to COVID-19. At this point, we had 23,036 deaths. The most U.S. states report widespread cases of COVID-19. April 30th, President Trump launches Operation Warp Speed, an initiative to produce a vaccine for the coronavirus as quickly as possible, with the CDC being the main contributor to that. May 2nd of 2020, the WHO renews its emergency declaration from 3 months prior, calling the pandemic a global health crisis. So here we are at this point. The U.S. has now taken over as the highest level of deaths due to COVID-19.
Who? Who?
The U.S.
Who?
Oh, the
World Health
WHO.
Organization.
Oh my gosh.
Oh, jeez.
I
sorry.
apologize for him.
Lame dad joke right there.
Horrible. Yes, I know.
Right.
He's coming back to the who's on first right there. Jeez.
So anyway, we're at the level where we are the leader basically, except for this is not something we wanted to be
I
the
was gonna
leader
say, that's
at.
not a good leader.
This is U.S. likes to be global leaders in things, but it's not usually deaths due to COVID-19. That's for sure.
Yeah.
Now,
So
I
at
don't
this
like
point,
how the U.S. did it because hearing now this is maybe conspiracy theory, maybe beyond actual knowledge. I don't have any facts on it.
Here's my tinfoil hat going on.
Right. But I understand that there's a lot of people out there that say these COVID deaths that were reported were not all strictly COVID related.
It was intentionally
deaths.
inflated. Is
That's-
what the
Because they-
conspiracy theory says.
Yes,
is
because
that
they
it was
died
intentionally inflated.
and they had COVID. It was a COVID death, even if they
Died in a car accident.
Right.
If they tested positive for COVID,
COVID
it
death.
was considered to be a COVID death. Yes.
So
And the patient was treated as a COVID death, so they basically
Right.
sealed the bag and
as a person that is extremely leery of government,
Yes.
I believe that more than I probably should or don't. I don't know for sure because I don't have all the numbers.
Right.
right. No, I don't think
Yeah.
anyone does.
I mean, the information is out there. I mean, you're going to see that the deaths are listed as COVID deaths. There's really nothing we can do to go back and say, no, that person died from some other force or some other way.
Right.
So to go back and kind of pick and choose that, it's a little bit of a hairy situation, I think.
And not
But
to
I do
mention-
believe that there were some inflation because, from what I understand, is that the states and the federal government were giving money to these hospitals based on the number of COVID deaths they were reporting.
Right.
And so these hospitals were intentionally inflating the numbers
Yes.
for their COVID deaths so they could get more money. I don't have proof of that. This is just basically rumor that I heard. I want to make sure that everyone understands that.
Yep.
No proof of that. It's just rumor.
Well, and it's
Pause. You hit your mic.
and I mean, it with our numbers of deaths, if you go back and look at the chart of where these deaths were happening at, it was major metropolis areas like New York City, Seattle, Washington, San Francisco, Los Angeles, where lots of people are smashed together with high-rise apartments and low-rise apartments and all that kind of stuff. And then you also had nursing homes, which got hit really hard because you got
Right.
patients who are already not in the best of health, and then you're having something that's basically attacking the respiratory system.
Right.
Yeah.
And it did nobody any favors where we didn't basically say, shut them all down. You know, we still allowed people to go in and out because we didn't know. I mean, when the deaths started piling up, we still didn't know everything we needed to know about how it was transmitted, how it was spread. You know, I think there was times there where people are like, well, it's, you know, droplet. Oh, now it's contact. Oh, now it's back to droplet. Oh, now it's contact again.
Right.
You know, and I don't think we still know exactly how it's transmitted.
I don't think there's enough data.
There's
is what
not.
it comes down to.
Yeah.
It's in the air for sure.
It's an aerosol.
That we know that, but
Yeah.
other than that, no, we don't know for 100% sure exactly how it goes around.
It's transmitted person to person through the air,
Yes,
basically
yes, I'm
through
sorry, yeah.
coughing or sneezing or something like that. It's not an airborne virus in the fact that it's just floating in the air and you can
Right,
breathe it in.
right.
It comes from
There it is. I see
yeah,
it.
it comes from person to person. Yeah,
I can duck.
Yeah, exactly. It's
It's like,
you know,
it's like the what was it, The Simpsons or the old movie The Fog?
Oh yeah,
Right.
the fog. Yeah,
Everyone stay in, you won't get it.
right. Amid all of the pandemic issues, some states and the U.S. government was seeing the economic reasons for getting the country back to normal as soon as possible. In April of 2020, Georgia, Alaska, and Oklahoma began to partially open their states despite concerns from the health experts saying it was too early to reopen. May 8th of 2020, news media outlets report the top White House officials shelve CDC guidance for implementing the Opening Up America Again framework that include detailed advice on how to safely reopen the country. May 9th, U.S. unemployment rate at 14.7%, the worst rate since the Great Depression. With 20.5 million people out of work, hospitality, leisure, and healthcare industries taking the greatest hits. So basically, we're seeing a huge economic downturn based on this. A lot of things being shut down, this causing issues with hospitality, leisure, and healthcare industry workers having a hard time finding jobs, or their area has been completely shut down, their place of work has been shut down, and they have nothing to do as far as being able to find a job. if you're somebody who's been a bartender or waiter or something your entire life, and that's your only skill basically, and all the restaurants are closed, you don't have much to do. There's not much for you to go to at that point. So, what do you think, Caleb?
So obviously, I work in the healthcare industry, and so does my sister, and I guess my older sister does. She's a vet. I guess that's healthcare.
To a certain extent, yeah.
To a certain extent.
Yeah.
So, but, with me, I was on actually a new team. I just started a new team in September of 2019. And basically, my division is what we call the IT division. So basically, anything and everything computer related, technical related, we're there. And even they shut down a lot of our teams. My team, which was just at the time, was just my director and myself because we were so brand new. We didn't get that luxury. We basically got a whole crap ton more work thrown our way because we saw the whole advancement and change of healthcare to the point where we had to do telehealth. My hospital I work for had absolutely zero telehealth before then. They were looking at it like anything else, but they're looking at the money and going, well, are we going to make money on this? And
right.
Obviously, when you have patients who can't come to the hospital because, the fear of getting COVID or the fear of having people around and spreading COVID, basically telehealth blew up and we had to work fast to get it basically up and running. And then, hospitality and leisure, Las Vegas, perfect example. They basically, it became a ghost town.
Right.
Bars, casinos, hotels, gone, shut off completely. And that's a town that never sleeps, technically.
Right.
I mean, it's always 24/7. And it's just crazy having, once again, like I mentioned earlier, living through this because this was something my grandparents lived through with the Great Depression, but I never thought it would ever happen for us.
Right.
I'm like, we're never going to have these type of things ever occur. Sure enough, there it happened.
Yeah, and the last severe pandemic like this was the Spanish flu in the early 1900s. Yeah. So even you have to go back to our great grandparents before you get to people that experience something similar to this, as far as a pandemic that has shut down the world and has hundreds of thousands of deaths across the world. All of that. What do you have to say, Paul? I can tell you have something to say. You got a big smile on your face over there.
If we had video, you guys would have loved seeing it.
Do not like this. So this pandemic, compared to the Spanish flu, the Spanish flu killed people, like damn near on the spot. I mean, they were, sick and died quickly with all the best medicines thrown at them. They tried everything they could to keep these people alive at the time.
Right.
Now,
it was the early 1900s.
It was.
Medicine was not what it is today.
I understand.
Oh, you got to cut your arm? Well, amputate that.
Yeah.
Well, I mean, sort of, yes. But now hospitals are restricted on what they can give. If a doctor thinks this medicine could help you, he can't give it to you because it's only for these things.
Yeah.
I don't like that. I want doctors to have full validity on whatever they do. I go to a doctor because I trust my doctor. If my doctor thinks that because this medication can do this, and this, and I have at least half of those, he thinks that it can help me, he's going to tell me, like, you know what? It ain't made for this, but it's a good opportunity right now. We can try it out. Right. If it don't work, we have an ER. We have, medical professionals that can bring you back to life with everything. I mean, we have other vices and possibilities that we can get into. Just saying that about that. So, I mean, I want my doctor to do what they believe is necessary. There's a good movie with, well, just cut that out because I forgot the damn movie now.
I will not cut that out. That's good stuff right there.
Michael J. Fox.
There you go.
He is a No. I can't remember the name of the movie, but he's a big time doctor, and he's driving to California for a great interview for a great hospital, and he gets stuck because his car breaks down in a small town, I'm sorry, his car didn't break down. He got pulled over.
Doc Hollywood.
Yes.
Doc Hollywood, yes.
Yes, Doc Hollywood. So he got pulled over. He had to do a little community service and fill in for the doc, the old doc. I mean, he was like 70 years old in this town. Been there since, he delivered everybody in the town damn near. I mean, that's how old the doc was. So he had to fill in for the doc. And he, in this situation, called a helicopter to a boy that he thought had heart problems. And the old doc shows up and says, "You got in your papaw's chaw, didn't you?" And the boy's like, "Yeah." And the doc's like, here's a soda. 35 cents. And that's, because the doctors at the level of the city know better for you and what is going on in your area than any other doctor, federal, WHO, the World Health Organization. I don't care where you are. My local doctor knows more about what's going on here.
They know
than
your
anybody
local
else.
area. They
Yes.
know what comes up in that local area, and they know how to handle that. They've seen those people, and they've dealt with that. That's pretty common.
I was gonna say that's why family medicine is so important, because you got the doctor who knows your health history. They know you, and they know how your body reacts to things.
They talk to you. They know you. They know that, some of us big boys are bigger boys because that's just genetics.
Sometimes, yeah.
I mean,
Sometimes
you
that's the
can't
case.
take a normal 5'8" person and compare them to a normal 6'8" person. I mean, those stats are completely different.
Right. 5'8" at 250 pounds is obese.
Bad. Yes,
But
I know I
6'8"
am.
at
Thank you.
250 pounds is not obese. That's somebody who's probably right in the right range of weight for that height. That's definitely the case. But as far as the doctors in the area, they know their local area. They know what to deal with as far as the normal things that come along with that area. They know what medicines work, what your medical history is. If they're your normal doctor, your family doctor, they're going to know your medical history better than somebody who's sitting in Washington giving a speech about medicine in a pandemic. So the vaccine that was pushed through at warp speed was now approved by the FDA in the U.S. and UK. So in December of 2020, the FDA issues a emergency use authorization for the first COVID-19 vaccine, which was provided by Pfizer. So that then went forward December 18th, 2020. The FDA issues an emergency use authorization for the second vaccine, which was the Moderna vaccine. And then December 30th of 2020, AstraZeneca and the University of Oxford vaccine approved for emergency use in the UK. February 27th of 2021, FDA approves emergency use authorization for the Johnson & Johnson one-shot COVID-19. These other vaccines prior to that were a two-shot or a multiple shot. You needed to go back for multiple shots. The one that was approved in February of 2021 was the Johnson & Johnson, which was just one shot. You have any comments on that, Caleb?
So, I mean, when the vaccine started firing up, obviously we had the whole, let's make sure healthcare workers get it first, make sure people in contact with people get it, first, like anyone who's direct contact with patients or people, let's make sure they get it first. I mean, we stood up what they call vaccine clinics to make sure we get as many people in as possible to just one after another, just to get them all vaccinated as fast as possible for those who wanted it. Because there's obviously just like anything else, freedom of healthcare choice is something we value in America. It's something we say,
Right.
if you want it, here it is. We're not going to force you to get it, but it is here if you want it.
Just like any other medication, you should
Yep.
have the right to refuse that medication. So basically, even if your doctor says you need to take this heart medication because your blood pressure is too high or your cholesterol is too high or whatever, if you're prescribed that medication, you still have that right to be able to say, no, I'm not going to take that medication because of this, that, or the other thing. It's your own personal feelings, your own personal decision.
Right.
Are we going to go ahead and get into the mandate now, or are we just talking about vaccine itself?
Just the vaccine itself.
Just the vaccine right now.
All right. So, because you guys were going into the mandate.
No, not yet. That's a little further down.
Okay.
I was talking about how we stood up vaccine clinics and basically we were giving it to people who wanted it. There was no mandate back then. It was just
Right. That mandate didn't come until later.
I felt it like going into.
it's going to get there. Don't worry.
We're almost there.
Okay.
All
right.
Flip your page, man. Follow along.
I am, but what you guys were saying
right
was
here.
no. What you were saying,
You're not following along, so you don't see it.
I'm following along. What you guys were saying, I was just
You're
going to
cut all
jump
this
in.
out
Yes,
right
I
now,
am.
right?
Yes,
Okay.
that's why I paused for a second before we started this.
Okay.
All right. So since that's
I-
what you want to talk about, let's move on to the next one, and
Okay,
then you can talk about
let's
that.
go ahead and do
Okay.
this.
All right,
One,
so-
two.
Yep. So the result of pushing any medication through quickly is that it can't be properly studied for short and long-term effects. This was shown by the pausing of the Johnson & Johnson vaccine. In April 13th of 2021, the CDC recommends pausing the use of Johnson & Johnson COVID-19 vaccine because of blood clot complications.
That's easy for you to say.
Yeah, definitely. April 23rd, 2021, CDC recommends continued use of Johnson & Johnson vaccine for people 18 and older. This bothers me because there's only 10 days between we're saying this vaccine causes blood clot complications, and now 10 days later, we're back to saying, okay, this vaccine's fine, go ahead and start using it.
Right.
That bothers me. I can't imagine. I mean, I don't work in medical laboratory. I don't work in any kind of medical field, but it just bothers me that 10 days is all that was taken to determine that this vaccine was okay now to be used on everyone. So, Paul?
The vaccines are one thing, and I completely understand, but mandating it to anybody at all is completely against my view of a democracy. Well, we're not truly a democracy. We're a democratic republic. So, being a person that truly believes that we should stay a democratic republic, mandating anything at all is against what I believe. But the government mandated it for all federal employees, and then they also mandated it for the military. And when they mandated it for the military, and
Page turning the newspaper. Everybody.
well, I remember what it said. They made it mandated for the military, but what were the consequences? And when they did that, they said the consequences for not following the mandate were left up to the local the commander of that unit. The unit, not even. I mean, there. How many levels? And you were in the Army.
Yeah.
How many levels between your commander and the President of the United States?
Oh, yeah.
Depending on what unit you're in, it could be 20.
I mean, you've got the company, then you've got the battalion, the brigade, the division. I mean, you're talking about multiple leaders along that chain.
Left up to their commander for prosecution of not following the mandate. So you could have your captain being your commanding officer and saying, I don't feel this is a good thing. So I'm going to mandate you to get the vaccine. You didn't get it? Oh, okay. We'll do an extra duty tonight for an hour.
Yeah.
But then on the other hand of that,
you could go all the way to Article 15. You could go all the way to court martial.
Yes,
with that. I mean, there's a lot of different things you can do there.
Getting kicked out of the whole military.
Right.
You could go from one commander. You're not setting precedent or setting rules even about what this could affect somebody. So you're just leaving it up to somebody, a captain. All right. When in the Army, even in the Air Force, captain, how long they been in the military?
Probably in the neighborhood of 4 or 5 years.
Yeah, 4 or 5 years.
It depends on if they were enlisted before.
What age are they? Normally.
I mean, there's a range of ages that come to captains.
But normally
they're in their mid to late 20s.
Yeah, mid 20s normally.
I was going to say 25.
Normally 20s, because they get out of they get usually a captain gets out of college, joins the military, 4 years, 4 to 5 years captain. So, what age you get out of the
if
college?
you're graduating the academy at 22, you do 4 or 5 years. Now you're at 26, 27 years old.
Okay. And
you're probably a captain. You're probably fresh into that 2-bar range, but
But our beloved government is saying that a 28-year-old with a college degree can say if an enlisted man that has been in for 15 years, served his country honorably, done everything expected, greatest soldier, airman, Marine, Navy, all the above.
I mean, I would hope that would hold some water for them.
I would hope.
It's not necessarily the case. I know there's a lot of people that come out of OCS or come out of the academies and
assholes.
They have.
Sorry, I don't want to cuss on this one, but these people, some of them I have met. Some of them, I'm sorry about that. Let's go ahead and edit that out. Well, some of these people that I have met have been, and I've met majors that are like
major
extreme a-holes. I mean, just to the extent, like, they just want that next rank so bad.
Right. They're the type of person that you give them just a little bit of power and they try to take it to as far as they possibly can. And, I have met those as well. I met good officers and I met bad officers.
Oh, yeah.
In any branch of the military, you're going to come across that. It's just like any other job that you have, even in the civilian world. You're going to have good managers. You're going to have bad managers. We've all been around that. So, when you allow someone at a lower level to make the decisions, I don't know how this is going down as far as the military is concerned, because neither one of us is still in. We're talking about it from outside, but I have to have the feeling that
newspaper that says that's what it is.
But I have the feeling that these decisions are not made at the company level.
I hope not.
They're being made at either the battalion level or the division level. This is it's probably something that's being recommended from the company level up, and then somebody at a higher level, that full bird colonel or that general is making that decision to whether to put that person through a court martial or an Article 15 or something like that. I don't think a captain with just a couple years of experience would do that. I hope not, but who knows?
Well, it goes to the same thing that us, or not us, but like people in this area are having the issue with right now is you have our area has 2 major hospital networks, 3 if you count the one that's in Springfield, and they are all mandated for vaccinations.
Yeah,
that's not coming from the lower level. That's coming from the people who are paying the hospitals, which is Medicare, Medicaid.
Right.
They are saying, you will not get funding unless your staff is vaccinated.
Yeah, and these hospitals rely on the funding from Medicare and Medicaid
Yep.
too much.
And that's the thing is you got people like our brother-in-law. He was on the front lines. If anyone has COVID and has gotten over COVID or has the antibodies for COVID, it's him. He was a respiratory therapist. He was in people's faces, not even having any idea how to protect himself when it
Right.
first broke
In the
out.
early stage, yeah.
Yeah.
In the early stages. And it's like now you have these people who are coming from up high saying you got to get it, or you're being, and if you don't meet this deadline, then you're on a final written, and if you don't get it by this time, then you're gone. Or if you are already on a final written, you're gone after that as well. So
Right. Well, talking about the vaccine, even though there are a large number of anti-vaxxers out there, it seems, according to the CDC, there is a great number of vaccinations being administered. As of March of 2021, the CDC reports that 100 million vaccinations have been administered. As of April 21st of 2021, the CDC reports that 200 million vaccinations had been administered. This was actually very surprising to me because, as I know, the population of the United States is only around 330, 350 million, somewhere around there. I say only, but I mean it is the third largest country in the world. But I was surprised to see that 100 million vaccinations administered, 200 million vaccinations administered as of April of this year. I didn't realize that many vaccinations had been administered. I know a lot of people in our area that are anti-vaxxers, did not want to get the vaccination. I being one of them myself, have not been vaccinated, and I will not be vaccinated until it can be proven what the long-term effects are of the vaccines.
Now, I'd like to finish this episode, and actually, I would like to probably finish every episode like this. I think we should do 2 minutes each of whatever your thoughts are on the topic of the day.
I'm okay with that.
Okay.
Cool.
So, who wants to go first?
You
I
go
say
first.
you kick it off.
You're the one that said it. You do it first.
I hate the vaccine. I hate the vaccine mandate. I don't believe anything. This is true. It's not that it's not true. There is a virus out there. It's not that I don't believe there is a virus. It has killed people. Don't get me wrong about that. I believe it has killed people, but the amount of people that it has killed is almost insignificant to anything else. Diabetes has probably killed more people in the last year than COVID-19. And I don't have that stat on me, but I'm just saying that there are more and more dangerous health risks to our country, to our world. HIV still is killing Africans and African Americans even at enormous rates. We need to kill that before we shut down a whole country's livelihood on a COVID-19 that, did you see anybody getting swept off the streets because they were dead from COVID? No, I didn't see that on the news. I don't know if you did. Maybe you did. I don't know if I did. I didn't do it. But I believe that vaccines are good for the most part, but they need to be tested and they need to not change my DNA. And therefore, I will never get the vaccine. I don't believe anybody should ever be mandated for the vaccine. Mandates are not, I don't want to say mandates are communist, but they're definitely a shoulder end to communism. Communism. It's just going to happen.
Kind of piggybacking off of what Paul mentioned, I believe mandates are kind of a bad thing in a way because you have a new technology. Yes, they were researching it beforehand, and yes, they had sample sizes and everything beforehand before it broke out. But you have people who like I mentioned, were on the front lines doing this type of thing, treating patients without a care in the world because it was their job. That's what they were supposed to do. They did it without the correct PPE because obviously without President Trump and pushing out, the Military War Act where he basically told factories that were making car parts and all that to stop and start making, ventilators and stuff. Alcohol breweries were stopped producing alcohol and started doing hand sanitizer. Just crazy things like this. They were doing this without all this equipment, and they are doing just fine. Yeah, like Paul said, there is a virus out there. Yes, it's not contained, but yet there's flu out there that's not contained. There's Ebola out there that's not contained. There's all these different, diseases out in the world that are not contained. I don't know why this one has been just blown up. Actually, I take that back. I do know why it has been. It's political. They are using it as a political crutch. And until people wake up and say, you know what? We just need to take one step back and look at it with wider eyes, we'll understand that, hey, we can live a normal life without living in fear. Now, I'll actually, give 15 seconds to you.
Well, I want to start off by saying I don't want to lessen anyone's grief or, over a loved one that has passed away due to COVID. I understand that's something that it was a tragedy that you went through. But in my personal opinion, I don't feel like a vaccine that cannot show long-term effects. What is going to happen to your body over 5 years, 10 years, 20 years after having this done to you. There's already been a huge push prior to all of this happening where people didn't want to get vaccines for other issues. There was, concerns of Alzheimer's, there's concerns of autism, there's concerns of many different, uncurable diseases that can come from these vaccines. And, it just concerns me that this vaccine was pushed through so quickly, was administered so quickly, and people just fell in line to take it. That bothers me in the fact that people are not making their own decisions. They're not getting the information together. They're not putting that all together for themselves and making an informed decision. They're just following blindly what the government is telling them to do. And I don't feel like in any case that is a good thing to do. The people that make these decisions are human. They make mistakes. They also make decisions based on what's best for them. They can make decisions based on money, on what benefits them as far as the monetary value of what is coming to them. So I feel like if you're not making an informed decision for yourself, for your family, that you're putting yourself at risk for anything and everything that could possibly come down that road. The vaccine is not tested in the same way that many, many, many other vaccines have been, and without that testing, I feel like you're just basically shooting in the dark, hoping that it's going to do what it said, what these people tell you it's going to do. So, anyway, thank you for listening. Again, all the information regarding COVID-19 was taken from the CDC website at www.cdc.gov and our local newspaper. Well, that was today's topic. I hope you enjoyed our candid conversation. If you have any comments about our conversation today, please email us at wick.splaining@gmail.com. And even Donnie has something to say.
Like, share, and subscribe.
Subscribe, all right.
And just to wrap that up, you can find us on Anchor, Spotify, Apple, and Google Podcast. Thank you for listening.
Thank you.